Hello, my name is Debbie Hayes. I'm a healthcare consultant for Eide Bailey in Denver, Colorado. We are so glad you're here and welcome. Thank you for joining us today. We know there's just continuing questions and concerns over all of the stimulus funds and different things that are going on, PPP and different programs. And so we'd like to help just synthesize and hopefully answer some of those questions for you here today. Our presenters will be Jackie Cole. She is a certified healthcare consultant in the Utah Eide Bailey office, and Eric Nuttall is a healthcare partner in the Utah office, and Shauna is the partner in charge of healthcare medical practices for Eide Bailey in Denver. So with that, Jackie, will you go ahead and start?
Today's agenda will be HHS Relief Funds, PPP requirements and limitations, the CARES care integrations, best practices for increasing revenue and reopening and HR considerations. HHS Relief Funds. Let's start with that. So most of you have received relief funds via HHS in your bank accounts. About $100 billion was allocated to eligible providers, healthcare providers and hospitals. $30 billion was distributed immediately on Good Friday, which it was the best Good Friday ever for me to see these funds roll out to medical practices. $26 billion was distributed. That came in the form from, it was United Health Group, Optum payments. The payments hit your bank via ACH, designated HHS payments. And the remaining $4 billion out of the 30 went out also on April 17th to various different other providers. This is a grant. It is not a loan. So I just want to make sure and clear that right away. It is not a loan. How is the money distributed? The money was based on your 2019 Medicare fee for service spending, which came out to about $484 billion. Each practice got about 1% of that based on what your allowables were for 2019. Now the information today, just a little disclaimer, the information today is updated as of last Friday, which is May 7th and 8th. So some things may have changed. Rules and regulations are changing fast and seems like on a daily basis. Funds were distributed based on participation and practice type or billing tax ID number. Providers that were not excluded from participating in Medicare, Medicaid, and other federal healthcare entities, or provided care to after January 30th with diagnosis, testing, and other care for individuals with actual or potential COVID. Employed physicians, the employer organization was paid. Physicians in physician groups, the group was paid, and solo physicians were paid under the tax ID number used. And one common thing that we see when providers are attesting, they say, I didn't treat a COVID patient. As the terms and conditions came out, a lot of you had questions about that. It states the recipient certified that the payment will only be used to prevent, prepare for, and respond to coronavirus, and that the payment shall be reimbursed the recipient only for healthcare related expenses or loss of revenue, and this is the kicker here, or loss of revenue that are attributed to coronavirus. Every medical practice in this country has been affected by the coronavirus. So this applies to every medical practice. So feel safe that these funds are for you.
Jackie, can I just ask a clarifying question? So when you go back to, but I didn't treat a COVID patient. So HHS came back and released guidance that said every patient is a potential COVID patient. Therefore, every practice that was treating a patient in any way was treating a potential COVID patient, correct?
I believe, I mean, everybody that walks in your workplace could be a COVID patient, so I believe that would be correct.
Okay, thank you.
But I would like to hang my hat on lost revenue, because everyone has lost some revenue. Also, for all the frequently asked questions, I put the link below. You are required to attest. The first round of patients, you have to attest the CARES Act, Provider Relief Payment Attestation Portal. It was 30 days. You had 30 days to attest. As of Friday, it's now 45 days. However, note that if you don't attest, you will automatically attest. They will attest for you to the terms and conditions. Now, additional funds were available. They are called general distribution funds. HHS began distributing the remaining $20 billion on April 24th. A portion of that automatically went to providers in advance payments. You receive your money automatically, but when you go to attest, you still have to put in your revenue information. All distributions were based on 2% of the provider share of attested net patient revenue, based on the latest submitted tax return or cost report, which is also required to be uploaded when you attest. Payments will go out weekly on a rolling basis, and they started going out on April 24th. Eligible for more funds. How do you know if you're eligible for more funds? So to determine that, you take your total net patient revenue, times it by 2%. So this particular example, this particular practice was entitled to $24,000. They were paid $12,000. So there is a potential of $12,000 more that they could go ahead and submit for. Now, where is your net patient revenue located on your latest tax return? I have a matrix there for you to find that based on your entity. So how do you submit for additional funds? Once you verify that the funds received are less than the net patient revenue based on the last tax return filed, you also then want to compare March and April of 19 to March and April of 2020 to determine an estimated, it's just estimated loss for those months. Now you can do that by encounter by month times the revenue per encounter. You can do it by gross charge by month compared to times by collection rate, non-rescheduled procedures, average times by your average procedure rate, monthly patient revenue. Most of the practices out there are cash-based. This is an accrual-based estimate, if you will. So please be mindful of that. And once you put in your information into the portal and attest, HHS indicates that payments will go out within 10 business days. What if you were overpaid? What do I do when I think I've been overpaid? So, generally, if a provider does not have or anticipate a loss or increased expenses equal to or exceeding the relief payment, then they suggest that you return it. In this case, this clinic is 1.2 times by 2% was 24,000. They received 32, so they have 8,000 that they were overpaid according to the 2% calculation. Now, again, this we don't at Eide Bailly, or at least I don't in the group here. I probably, with this low of an amount, would hold it in a separate account and reserve it. Remember, this reporting is just for 2 months of estimated loss, which we think they're kind of benchmarking the losses just to kind of get a feel for the industry. May is going to be the worst loss that practices have seen. April was getting, rough. May, we're just starting to rev up. Patient volumes may not be there. June may be, equally as it down. This is a whole year's worth of losses that we could capture. So we recommend that you hold those funds, in reserve, whether it's a separate bank account or just put them in a savings account away from general spending, versus maybe refunding.
Jackie, we had a question from the audience, or maybe a clarification. The net patient revenue that you're talking about, is that just Medicare revenue, or is that revenue for the entire practice?
That is revenue for the entire practice that is based on your tax, that's on your tax return, your latest filed tax return.
Thank you.
How to reject funds. Many providers out there said, I don't want any clawbacks. I don't want these funds. You can choose to reject them. You go on to attest, and there is an option to reject. Reasons to reject or return immediately would be if you are excluded from Medicare or Medicaid or any other federal health care program, or you don't currently bill Medicare, or your privileges were revoked, you are unwilling to accept terms and conditions, you have not billed Medicare or provided after January 31st diagnosis, testing, or care for individuals with possible or actual cases, retired between January and February. In other words, you're no longer in business. You sold your practice in late 2019 somewhere, merged in with another practice. We highly recommend that you do that. Again, the portal will guide you through how to reject and the terms and conditions, and then walks you through how to do your refund. There is also a hotline. I put the number on here for you. Now, to attest to these the additional funds, it is a different portal. It's called the General Distribution Portal. And you just click on there. You put in the March and April information, and then you upload your latest tax return on file with the feds. How do I track these relief funds? We've had a lot of questions on this, and essentially you do want to isolate these funds. You want to isolate every fund that you actually get through these periods, but isolation means opening up another bank account. You could call it COVID HHS Relief Funds, or you could segregate it in your accounting system, create another income account. If you're going to do that in your QuickBooks or Quicken, you do want to call it Relief Funds HHS-2020 Law 116-127, as stated here. The feds do have a guideline for that designation. You'll also want to, segregate your cost center with your normal operating expenses, which is really easy to do. If you have QuickBooks, you can actually just do classes. Classes, maybe you could do a COVID class, and then everything that you pay, you could put into a class. You probably received a separate payment for each tax ID number until further guidance is received. The relief payment attributed to the tax ID number should be used only and authorized for the expenses related to that tax ID number. Now, we have had some that have had the wrong term and conditions. There are different terms and conditions for different funding pools. The first, the 30 billion, had its own terms and conditions. The 20 billion will have another one. Family First Coronavirus Response Act Relief Fund will have another one. Uninsured Patient Fund, Highly Impacted Fund, and Rural Providers. So please make sure that you attest to the right terms and conditions. Big question, will HHS take these funds back? Oh, I hope not. We did have an HHS spokesman talk on May 5th, and generally HHS does not intend to recoup the funds as long as the provider's lost revenue and increased expenses exceed that amount of the relief fund. Well, you've only received 2% of your entire income for one given year. So we should see how, you know, March, April, May, June, July, August, September, October pans out. HHS does reserve the right to recoup all or portion, one paid in error, and if you're not eligible to receive those funds. HHS reserves the right to audit any of the recipients, and providers must ensure that the total loss exceeds any of the funds received. You have not received any funds? Well, HHS had these targeted allocations. There was about 6 different categories. The one that was really particular to medical practices and our dentists was the very last one. Nursing facility dentists and providers that solely take Medicaid, your funds are coming. It is unknown. We don't know how they're distributing these funds. We hope it's based on your 2% of the last tax return. That would be very easy, but we've heard it's some calculation of Medicaid, so we're unsure. You are likely to get these funds actually this week. It did say the 2nd week in May, so if not sooner. Other reasons why you may have not received any funds: you've changed your information with CMS, your Medicaid billing had been terminated, your revalidation, those type of things, etc., have not been completed. You were terminated from participation. You were precluded from receiving or billing Med Advantage and or Part D, or you do not accept or bill Medicare, Medicaid, or any other federal program. If that is the case, then I highly recommend for all my providers out there that do not bill Medicare, Medicaid, or any other federal health care to actually request for payment to HHS. We have all the information to send your request for payment in. I suggest you contact your association and fight for your share of the funds, and even contact your state and national representatives. Some of these providers that we've seen that are not receiving their funds are infertility providers, plastic surgeons, direct patient care providers, concierge providers, psychiatry, psychology, and many others that you probably are out there that don't bill these. Again, request these funds. It should be every provider. So. Next biggest question that we have is, how do we spend this? So it's really easy. Normal everyday overhead costs, except for physicians. Your limit per month is $16,441.67. That's it. Or any other executive in your firm that's, you know, over $197,300. But no expenses for which the PPP funds are used, or any other funds. Okay, tracking lost revenue. This is where we really need to watch. I have heard that there's other funding, phase 4 coming. You know, who knows how much more funding we have, how much more attestations we're going to have available to us. I hope there's a lot more funds coming your way for sure. This is going to be a running total for 2020. It will be the entire 2020. So to attest, you know, we compared, you know, the March and April. However, let's track it every month so that if they do decide to tell us how to report You have it on a monthly basis, you can do it on a quarterly basis, or you can add them all together and do it on an annual basis. Currently, it is unknown what reporting requirements are going to be out there. We do know that in your terms and conditions, anybody that received over 150,000, we know for sure will report. But let's track these losses. That's the biggest part of this. Now, there's a whole bunch of requirements, restrictions, and limitations. I didn't put the buying a chimpanzee, sorry, on here, but there was a lot of crazy other things. I avoided all of those. They are on the terms and conditions. But funds can only be used to reimburse non-refundable services. So if in the event you do, funds will or services will be reimbursed for something, don't use the funds for those. Providers agree not to seek collection of out-of-pocket payments for COVID. We've had a lot of questions on that. Mostly this is for, out-of-network providers, but we do have a lot of providers that say, should I collect my copay or the deductible? I would say if the patient's calling in and they're feeling sick, I would say that copays and deductibles at this time would not need to be captured. I do believe Blue Cross, Cigna, and what was the other one, Deb?
Aetna.
Aetna did come back and confirm with Trump that they would waive all the copays and deductibles. In other words, be paying you 100% of your contracted rate. But let's watch this because some of those provisions may not be there. You need to comply with IRS internal controls, effective and efficiency of your operations, reliable reporting, and compliance. So those are fairly easy. Funding for this is something that we can tap into. Funds for treatment of uninsured. So any patient that has been, never had insurance or have lost their job and have lost insurance, you can actually sign up to get reimbursed for this. It was announced early April, and it's part of the $100 billion. And each provider, clinician who has provided treatment for uninsured COVID patients on or before February 4th, so they retroed it back, can request and send claims for these services. So physicians, this provision with physicians services provided to uninsured patients, such as office or emergency visits, include via telehealth and may be reimbursed in this manner. I do know that they're going to be paying Medicare rates on these services. So steps will involve enrolling, checking eligibility, submitting patient information, then submitting your claim to actually HRSA and receive payment via direct deposit. You can start registering as of April 27th. So I've provided the website where you can go on and do that. And then they too also have an attestation. I'd like to turn it over to Shauna Schaefer out of Colorado.
Thank you, Jackie. So I am going to go over the PPP loan forgiveness. This is not going to be a presentation on actually receiving the PPP loans. We have several of those webinars up on our website, so please revisit those if you need, or reach out to one of your Eide Bailly professionals if needed. Also, I wanted to let you know that I am going to be giving a very consolidated overview of PPP loan forgiveness. Eide Bailly is hosting a full 1-hour presentation tomorrow with our just muted myself again. I'm so sorry. If I am not answering your questions today, please go ahead and register for that webinar tomorrow and people will be happy to help you. The PPP loan forgiveness kind of has a few what I'm going to call magic buttons to make sure that you're covering all of your loan forgiveness. So the first is we're going to be measuring expenses that we incur and pay during our 8-week covered period, and I'm going to come back to incurred and paid in just a moment. The 8-week covered period is going to begin on the date that you receive your PPP loans from the bank. In order to maximize loan forgiveness, you do need to do 3 things. You need to maintain your salaries and workforce. You need to spend at least 75% of those PPP dollars on payroll costs. And then you need to spend the remaining PPP dollars on other covered costs like utilities, rent, mortgage, and interest. So as we were talking about this, we were talking about a lot of the questions that we were getting from clients and questions that we were getting over and over. So the first is, what are wages or salaries under the PPP umbrella? So the first is our traditional salaries, what we're going to pay an employee that's going to show up on their payroll stub. So that's going to be any paid time off that you would normally pay your employees. That's going to be salaries and wages up to $15,000. I'm going to get this number wrong, Eric. $366. It's $100,000 divided by 52 weeks times 8 weeks for those highly compensated employees. It's going to be bonuses that you would traditionally pay during this period. There's some talk about other bonuses that we'll cover in just a second. But pretty much if it's going to show up on a pay stub in that normal wages and compensation section, that's going to be wages for the PPP dollars. On top of those amounts, also any employer portion of group health insurance, employer portions of retirement costs, and then the employer portion of state and local taxes, that's also included in your wage costs. So think about when you look at a pay stub, those wages that are on the left-hand side, and then you're going to stack on top of that those benefits. That's what we're looking at for salaries, and at least 70% of our dollars have to be expended for those amounts. So we'll go ahead and talk about here, I think this is a good part to talk about incurred and paid. So right now the language under the Act and under all the SBA guidance says that costs must be incurred and paid during this 8-week period, which means that we have to look at this from an accrual basis type of concept. What actually did it's for the pay periods beginning on the date that I received my funding, but then it also has to be paid, which is more of a cash basis concept. Right now at Eide Bailly, we are asking you to focus on this incurred type of concept. So if you're paying for wages from 3 months ago, that's not going to count for your PPP loan. These have to be for wages incurred during the period. And right now we're hoping for more guidance, but right now we're saying you may have to run a special payroll at the end of your 8-week period to get everything paid within that period of time. Some of the other tricky items that occur during this incurred and paid is, what about retirement benefits? So I would say most of our employers right now don't pay their retirement until maybe September or October of the year following when those benefits are actually incurred. We're saying this year, do your best to estimate what you incurred, maybe an employer match for a 401k program, maybe an estimated defined benefit amount, and pay that amount during that 8-week period of time.
Shauna, if I could just clarify one thing there.
Absolutely.
Don't just pay for the doctors. You must fund for all employees. Take last year's total contribution, divide it by 52 times 8, but don't just fund for the physicians. That is not allowed.
Absolutely. You have to follow the same top-heavy rules that you would have to follow if this was an annual contribution. You can't just benefit those higher earning employees. Thank you for that, Eric. The other part of this that I really wanted to focus on and talk about, because I think it's been slipping under the radar a little bit, is that you do have to maintain your full-time equivalents during this period of time. And so they're going to say, what were your full-time the measurement periods are, what were your full-time equivalents during the period February 15th through June 30th, 2019, or January 1st through February 29th of 2020. So you're going to look at your full-time equivalents in those two periods, and we're going to find the lower number. So if for my practice, I had 4 full-time equivalent employees in January and February of 2020, and 6 between February 15th through June 30th, 2019, I am going to be able to use 4 as my number. I have to have at least 4 full-time equivalent employees during my covered period. Let's say I only was able to bring back 3 of those full-time equivalents during my covered period. If I then bring back that 4th on or before June 30th, 2020, the reduction in workforce, or that full-time equivalent measurement period, is not going to apply to me. Also, Debbie's going to cover another exception later. Sometimes people just won't come back to work, and they've given us some guidance on that as well. The second thing I have to do is I have to maintain the wages for my employees at least 75% of their wages as I compared it to those other periods. And again, the whole point and what SBA is wanting to do and what the CARES Act is wanting to do is these PPP loans are supposed to keep people employed and supposed to keep them on the same paychecks. So if you're decreasing your workforce or decreasing their salaries, there's the potential of your PPP loan not to be forgiven. So that, again, was really high level. Please reach out to somebody if you have additional questions about the reduction in FTEs, the reduction in salaries, or how you spend your PPP dollars, or tune into our webinar tomorrow. The other piece that I wanted to go over is the integration of the CARE Act with other parts of the PPP the PPP integrated with other parts of the CARE Act. Thank you. So the CARE Act included a lot of provisions. Jackie just went over HHS relief dollars. I just talked briefly about PPP. Eric in a little bit is going to talk about the FFCRA and the payroll tax credits. EIDL loans were also available. I actually talked to one of my practices and she received a really significant EIDL loan. And so a lot of the questions out there is, can I take advantage of all of these programs? In some cases, yes. In some cases, no. I would say in general, you are allowed, for example, to have a PPP loan and an EIDL loan, but you can't expend those dollars on the same things. So this particular practice is going to use PPP dollars to get her cert through a certain period of time. And then if she needs to, we'll use her EIDL loan dollars to get her through the rest of the year. She may just pay back that EIDL loan as well, because that truly is a loan. It is a 30-year loan and it does have some favorable interest rates, but that's still a loan, not a grant. So it's important that you know that all of these programs, while they're separate from each other, they all have different pieces that interact, and there is no double dipping. So
I have a question for you.
Yep.
So if I got HHS funds that just showed up in my account, I've applied and got a PPP loan, and I applied for the EIDL loan and got a $10,000 grant. So I can use all of those, I just can't mix and match funds, correct?
That's right. So you can use all of those so long as you can demonstrate that you qualified and you had the need for them. You just can't use them for the same amount. So for example, I can use my HHS dollars maybe for some supplies, or maybe to pay for some, let's see, maybe some malpractice insurance, and then use PPP dollars to pay for those wages, utilities, etc.
So as Shauna said, we've received all kinds of different funds. The CARE Act had various pieces. And how do these interplay. So FFCRA, the Family First Coronavirus Relief Act, that kind of got lost. That came out in early March. It got buried by the PPP. We've kind of forgotten all about it. I think it has some advantages. Where the employment tax deferral, when the PPP or the CARES Act first passed, we thought this was an either or. And the IRS came out with some explanation that there is some way we can use both. Of course, the PPP, and then one that's really fallen off the radar for a lot of practices is the employee retention credit. And I'm just going to talk on that lightly. And that is mutually exclusive from the PPP. It is either or. And one word on the PPP funds, because right now most of us are in our 8 weeks. We're focusing on tracking our expenses for forgiveness, as we should be. Don't go into this thinking you're going to get everything forgiven. You probably won't. And lastly, the other thing I'm hearing is don't make bad business decisions to chase forgiveness. Make the smartest business decision first and foremost. Stand back, take a minute. Right now, we are hyper-focused on this forgiveness, and I think it can lead to some poor business decisions that we'll be sorry for. And some of it is what I'm going to talk about in a minute. We might miss opportunities. So the Family First Coronavirus Response Act, that was the leaves, the sick and family leave. Like I said, it completely got buried by the PPP. Realize the concept is let's conserve cash. If we play this right, the IRS will pay for some of our employee leave time if we pay attention to it. And we do know that employees of healthcare companies can be excluded, and that's soup to nuts. If they're in your office, the answer is they can be excluded. And some have wanted to do that. That's an individual office decision. And the other thing that is in order to have the leave funded, the employer must be in practice and have a work for the employee. In other words, most of our dentists were shut down for a time period. Being shut down is not automatic leave to be funded by this act for your employees. You've got to have work for them to come to. But the point of this act was to have our various sick and family leave paid for immediately by saving our employer payroll tax deposits, or I should say broadly, our payroll tax deposits, period. That it does include the employee withholding even. The two pieces were first a paid sick leave. This one I do see people using. If somebody gets diagnosed with COVID or is asked by a doctor to self-quarantine, then you mandatorily must add 14 days leave in addition to your current sick leave. This is for a maximum of $511 a day, $5,100 total for employee leave. For themselves, if they themselves are sick, and if their family member is sick that they're caring for, it's at 2/3 pay max of $200 a day. The $500 it's up to $500 a day. This is a whole separate program from PPP. This program can pay for your employee's sick leave. I think there's some advantages of using it and using the PPP dollars elsewhere if we can meet the 75% test, and we'll talk about that again. And then the family leave, if nearly all of our office staff have kids at home, many of them do, that they could be caring for or want to be home caring for, and many are home caring for them. They simply have to request this. Their first 10 days are unpaid, and then after that, it's 2/3 of salary up to $200 a day for $10,000 in total. Now, this one gets a little complicated because they may be better off on unemployment financially. And you may want to have that sort of discussion with your employee. Hey, should we just consider you furloughed? Some practices out of principle have not wanted to do that and have chosen to use this leave instead, and that's fine. But do know that whether it's the Family First Coronavirus Act, whether it's unemployment, whether it's PPP funding, forgiveness, it's all a way of having the government help us pay to keep our employees paid during this time. And we kind of need to look at all three at once and say which works best for us.
Eric, This is
Yes.
Jackie. Quick question. Can we go back to that slide real quick?
Maybe.
So I'm a medical practice and I have less than 50 employees. So FMLA does not apply to me.
Right.
But what if I did? Maybe I did say, hey, you know, your kids are home. We don't want to lose you as an employee. We want you here, whether they're sick or caring for someone. Can that still apply? Can I still follow the FMLA rules, even though I don't have to, and do this type of funding?
My understanding is yes, that you can opt out of this because you're under 50, but it's not, you're not automatically out because you're out of 50. You're actually automatically covered by this and can opt out if you're under 50, is my understanding.
Thanks.
Any clarification on that, Debbie?
No, that's correct. Yeah.
So the other part of the CARES Act is this employer FICA tax deferral. And at first, when this first got passed on March 27th, we thought it was PPP or this, so this doesn't apply. And about 2-3 weeks later, on one of the FAQ sites, the IRS came out and said, yep, you can do this. So specifically, that we're only talking about the 6.2% employer FICA cost. That's what we're talking about. To give you perspective, that's $62,000 per $1 million of payroll. So it's not inconsequential when we're talking about trying to conserve cash, get our doctors some compensation during this time period. This is the easiest loan you will ever get. It is interest free, it is loan application free, it is loan fee free. You just do it. It's automatic. You just choose to not send in your employer FICA. We haven't seen the 941s, but the concept is this will be accommodated. It did start immediately March 27th, and it runs to the end of 2020. There is no reason you can't short your current Q2 employer FICA deposits in order to claw back what you may have already paid the beginning of this quarter. Obviously, we're going to need to do the math to figure out how much you can short your payroll tax deposits to get that back. This runs until the date that your PPP is forgiven. And I'll talk about that just a little bit more, but you are eligible until that date. The amount that you've shorted your payroll tax deposits is then payable half December 2021 and half December 2022. So a pretty lenient repayment period as well. Some coordination is employees on the FFCRA, they are on leave. They are on, even though the government is helping you pay for them, they are on your payroll. They count toward the FTE count that Shauna spoke of. Remember, it's a dual test. FTE count, 75% of our total PPP dollars have to be on payroll. So we've got two tests here. It counts towards the FTE count. But if we let the government pay for these employees on leave through the FFCRA, that is not our payroll cost. So it's not part of the 75% test. There's no reason you couldn't do this and then decide maybe before the end of second quarter payroll tax filing to not short your payroll tax deposits in order to, or to get them refunded, I guess you would be doing at that point, to have them count toward paying for this leave. So you can kind of leave that in your back pocket in your Q2 filing. By then you likely will have already ran the 8 weeks of your PPP. Where are you on your 75% test? Are you over? Well, then let's use some of this. And if you're under, then let's not use FFCRA funding because anything covered by the FFCRA does not count towards a 75% test. And like I said, on the FICA tax deferral, we have until the date our loan is forgiven, which could be about 4 months from the funding date, 8 weeks of the forgiveness period. And then the banks have up to 60 days to figure out the forgiveness. Don't know if they're going to use the whole 60 days, but in theory, we could have up to 4 months of employer FICA tax deferred. And for a lot of practices, that's not an inconsequential amount to save.
Hey, I got my hand up, Eric.
There she is.
Go back to the other slide. So from what I heard from Shauna is that our state tax is reported for the PPP loan, not our FICA tax. Is that right?
It's the state, usually it's the state unemployment that we're talking about. Depends on your state, but in Utah, it's your SUTA. I don't know what it's called in Colorado. It's your state unemployment. For Californians, there's also a SDI portion, state disability. So don't hear employee state income tax withholding. No, this is employer state payroll taxes. It's our unemployment insurance primarily.
So if we're reporting our unemployment insurance, state unemployment insurance, but we're not reporting our FICA on the PPP, correct? For the
Correct.
employer's
The employer FICA is specifically excluded from payroll under the PPP. Yes, that's correct.
So we can short over here, but we can't, we've got to do some adjustment, even though we're not reporting it, correct?
That's right.
Wow, interesting.
That's right.
Thank you.
That's a great question. Thank you very much. The employee retention credit. So this kind of fell off our radar, working primarily with medical practices and dental practices, because nearly everybody jumped into the PPP loan. And in order to qualify for this, your revenues had to drop by more than 50%. And at least when this first happened, I don't believe the dentist had quite been shut down, so that really wasn't on anyone's radar yet. And I don't know of many practices that did this. A lot of bigger businesses are. This is what's available to them if their revenues dropped by more than 50% or if they were shut down. And the only thing to say about this is if you do the employer retention credit, which is a credit against, again, your employer payroll taxes, employer, against, it's 50% of the employee's salary up to a maximum of $10,000 per employee. You cannot be doing the PPP loan. So this kind of fell off our radar because of that, but for some, it might still be applicable, and it's not a bad deal. There are some that this might have been better, and we just jumped into the PPP anyway, and now this is off the table. But if you either haven't got your PPP yet, because I haven't heard if the second round's been fully paid out. I haven't heard of them shutting it down yet, but I think we're close to that. This is still available if your revenues have dropped by more than 50%. And Debbie.
Thank you, Eric. I appreciate that. Well, I'm going to talk a little bit about best practices to reopen a practice and get yourself going again if you've been closed. So we're going to talk a little bit about some steps to take prior to reopening, universal precautions, some financial and staffing considerations, and how to maintain or increase revenue. So one of the first, many of you, I'm sure, have already done these things. You're on top of your practice. But the first is obviously to consult with your local healthcare departments and find out what you're required to do for that, because that can vary widely from not only state to state, but county to county. And then the next thing is develop a plan, a financial and staffing plan. This is going to be a big deal, your roadmap for how you're going to get up and going and do a cash flow projection. So most cases, this will be a gradual reopening. Most practices won't open up and be right back at full volume. Many patients are nervous about coming back in, and so you may not need to be fully staffed at all times. That's typically your staff is one of your largest expenses, so you can plan how you are going to staff, whether it's on a rotating basis or how you will do that. One little important tidbit here is to verify your liability coverage and make sure that that's in place for treating patients with COVID, and if any liability, if patients would claim to contract that at your location. Then developing safety protocols. these are the types of things that we've all been hearing about, you know, wearing a mask, cleaning, doing these things, but you really need to make these written policies and have these available and communicate them with your staff and your patients so that everybody's clear on what they're supposed to do in particular situations. And then looking at what's your access to supply of PPE. There's been obviously some shortages, and whether you'll be able to get that to cover for all of your staff, whether you will have some available for patients, et cetera. So wanting to do that as well. Telehealth, if you haven't already jumped into telehealth and been doing that, this is a great time to do it because it allows you to see patients, less patients in the office, which keeps it a little bit safer, and also possibly see more patients in an hour, and you can get through some of the backlog of your patients. So the other thing is when you're talking with these patients and scheduling them, we really want to communicate. This is an extremely anxious time for patients, and they are concerned about coming back to medical offices. And one of the things we need to do is explain to them is that actually a medical office or hospital can be one of the safest places to be right now. And you want to let them know all of the precautions you're taking and how you plan to keep them safe, as well as the way some things may have changed when they come to the practice, whether they can not bring visitors with them, or if they're going to have to wear a face mask while they're there, things so that they're prepared for before they get there. And then one thing thought of is that there might be possible medication shortages. It's possible that with some supply demands and patients coming back to offices, that some of the regular medications may not be available, and physicians are going to need to work out alternatives and communicate those with their patients and how they do it. And finally, it's just, you know, this is all about rolling with the flow right now and adapting to your circumstances. So you may have to change suppliers or find alternatives for a while. You may have to prioritize or triage your patients to a certain extent to find out who can come in the office or who do you need to see first, or even possibly suspend a portion of your operations for a little bit. So universal safety precautions. Again, this is so important in a medical office, and just want to make sure that you're covering as many bases as you can to show that you're trying to keep you're doing your best to keep everybody safe. One possibility is to, when you're scheduling your patients, is talk to them at that point about if they have any COVID-like symptoms, if they've had any fevers, any recent travel, et cetera. So you don't even get them on the books and have a problem if they have. Temperature check all patients as they enter and ask them again about their COVID symptoms or not. And it's really important to document this in their chart so that you show that you've asked, that you've taken the temp, and that you've gone through that. And you may even want to have patients actually get a COVID test before they come in to do a procedure or surgery, because it's not a good idea to do any of those on patients who are currently active. And since some of them are asymptomatic, they might not know. Make sure your staff knows the CDC guidelines on sterilization and cleaning and all the areas of the office that you may not normally think of, doorknobs, light switches, credit card machine at the front, all those things that people touch all day long that we don't really think about, and requiring universal face coverage. This is obviously a big deal for everybody, especially the staff as they come in contact with everyone, and needing to be aware of the fact and cautious about people who might have respiratory diseases and how that may affect them, particularly some children. Let's see here. It takes it just a minute. Maintaining physical distancing. You may need to change your office so that the layout is a little bit different and you can keep people apart as much as you can, whether that's pulling some chairs out of the waiting room, whether it's having separate entrances and exits for patients to go into, whether it's putting an elderly or immunocompromised person in a room before so they don't have to wait in the waiting room, or even having separate appointment times for those people so that they're not even around when somebody else is there. And then consider strategies to let patients be seen via telehealth, as we talked about before. One thing too is put away things in the office that can be touched, like the waiting rooms, like magazines, coffee, any of those things that you normally would have out that people would all be touching. Make sure your staff knows how to wear PPE, how it works effectively, what the reuse guidelines are, and have, as one of those policies that we talked about earlier, a quarantine policy. If you have an employee that either test positive or symptomatic, what your policy is going to be regarding quarantine of 14 days or more. For your practice as a whole, you just want to make sure before you get into this that you kind of look at some financial considerations, and that's number one is a capital need to be practiced and additional funding. That these guys have touched on all the great sources we've been offered through the government, and those are very helpful, but you may also need to end up increasing a line of credit or doing something else to help you get through these leaner cash flow months. Another way to address that is to look at your accounts payable and your vendors. Read through the contracts with them and see what your obligations are. Talk to them, see who is willing to defer, who's willing to reduce some payments, and what you can do. The biggest thing is if you just, as you know, if you make contact and talk to them, they're much more willing to work with you, and you can put that into that budget and work that through the end of the year as your cash flow starts to come back up. So develop that monthly budget. As you said, AR, some of the cash flow isn't going to hit until now. You may have stopped seeing patients, but you're still collecting on AR from 2 months ago, and it hasn't seemed so bad. So even though you're coming back to see patients, you're not going to have that cash, obviously, for another couple months. So this may be the actual hardest months is when you're back in business, paying those payrolls, and not getting the AR that you have continually going on. So again, you can mitigate that through vendors, and of course, always through strong revenue cycle hygiene. These are things that you should be doing as an ongoing basis, but we want to make particular attention to now. One is that many patients may have either lost insurance, changed insurance, copays and deductibles may have changed, so need to make sure that your front desk is getting that information up front, that we're collecting the right amounts, collecting any outstanding balances prior to the visits if you can, and then just, figuring out how you want to follow up on AR and how you're going to work on collections, and maybe setting up more payment plans just to get them in the habit of making payments, even if it's lower amounts. And of course, a big one is monitoring your insurance companies to make sure they're paying the correct amount for telehealth visits. These amounts have gone up and down, and not all of them have been paying on the correct amount. So this requires a strong rev cycle team right here to make sure that they're collecting that. Staffing considerations. People are much more comfortable when they have a plan. So the biggest thing is they want to know when they're going to go back to work. Are they going to be full-time? Are they going to be part-time? How is that going to work? So they know how to plan out their life. So you need to figure out how you're going to want to run those shifts, and how you're going to have people come back. You might want to consider scheduling employees in rotating shifts, so that if one group contracts COVID or is exposed to it during one rotation, you at least have the rest of your staff to help carry out the practice operations, the rest of it. They as well need to take daily temps on a non-discriminatory basis, everybody who comes in, from managers to everybody else. And for staff that may themselves be vulnerable, either by age or health conditions, may need to make adaptations to either minimize their risk or exposure to patients, or not to allow them to return until it's safe. Of course, working through unique childcare arrangements, which can still be a challenge for some. And this is, again, where a policy might be a good idea about this is a temporary way that we can deal with this, and it's not meant to be the long-term how we're going to allow people just to work at home when they want and come into work when they want. And then, of course, so just supporting your staff. This is a tough time. This is emotional for everyone. They've been worried, as everybody else has. They've been taking care of a lot of people. They're tired. They're working dangerous conditions, and you just really want to do what you can to support them emotionally and physically, and let them know that you care for them. So one of the last just couple tidbits, points is expand your appointment options. This is the time you've been closed, you're going to have to make up some business. So add some hours, add some days, weekend days if you can. Make sure you're calling back everybody that was on your patient list that you had to cancel or reschedule, and get them back in. And that's a great time to have someone talk to patients about their concerns and work through that with them, because even you may post posters and put things on your website about your safety precautions, but sometimes people need to talk through their particular circumstances. Inform your referral providers that you're open providing safety measures that you're taking care of their patients. And then having determining a self-pay rate or a deposit for services if you don't know a copay, so that you've got a good portion of your service cost covered for that visit if you can. That's always a good practice. And as other good practices, code correctly for your services. In telehealth, it doesn't have to be the normal E&M visits, is all MDM in time, length of service. So make sure that your providers are doing that. Submit your claims within 24 hours of service if you can. Get that rev cycle back up and money moving through there. Contact those payers if they're not paying the telemedicine rates at the correct rates, and stay on them and get that caught up. And if you're having problems with them, then you may need to go to the commissioner of insurance or something to work on that. But it's all going to be about knowing your contracted rates and being able to have someone follow up on that and have them loaded. One little tidbit too is if you did not submit your 2019 MIPS data, they are going to automatically receive a neutral payment adjustment for the 2021 year. So that's kind of a nice little buy to not have to worry about that in between and not get any ding if you had anything. And finally, just a couple HR considerations. The Department of Labor put out some new guidelines about COBRA that during this time and until 60 days after the public health emergency, employers and plans are to suspend the deadline for employees to elect COBRA or to pay those premiums. Normally, they have a couple of months to decide to elect to it and then pay for them to be covered, but they're waiving that until 60 days after the end of the public health emergency. Group health plans, disability, and pension plans are doing the same thing for ERISA. They're giving them until 60 days after the end of the PHE to provide notices and disclosures. And they're also extending some planned filing dates for the 5500s as well. And the PPP forgiveness, Shauna touched on this, but this is something we're starting to see happen, and some of you may have already, and that is employees not wanting to come back to work when they're called back. Some of them are making pretty good money at home on unemployment now that the extra $600 is added to their income. And I did the math, and that a person up to $60,000 a year can actually make more money on unemployment than working potentially. So that's something you might run into, is either for that reason or maybe they still have childcare considerations or whatever it is. But a question has been is if an employee refuses to come back to work, does it reduce my PPP forgiveness? And the answer is no. If you can show that you have made an offer of unemployment and documented that the employee declined it, then that does not have to count against your PPP forgiveness. The one thing the employee needs to realize, though, is that unemployment may likely be suspended if the unemployment office is notified that you offered a job and they had a possible position and they refused it. So they need to make sure they know that. And then just making sure, yeah, go ahead.
I think that specifically says that has to be documented in writing, meaning the offer
patient
to the employee.
Okay.
And then of course you fill in the response.
Got it. Yeah, like yes. So through email or however you have to do it, right? Okay.
And most unemployment offices have a form that the employer completes if they've offered the job back and it has been declined. So it is on every state unemployment website.
Nice. Okay. Thanks. And just making sure you're taking care of your furloughed versus layoffs. When you were doing them, which you've probably already done, you just need to be consistent with how you're treating those employees. One of the main differences being that furloughs employees may have an option to return at some point, and they can keep insurance benefits in the interim, whereas laid off are termed with no intent to return. It doesn't guarantee a furlough employee that you're going to have a position for them. Things may change. Your practice may not look the same when this is over, and so that may end up switching to a layoff at some point, but that they have the option and they have the ability to keep their insurance, which is the big point. And the ACA has listed that for full-time employees, which they deem 130 hours or more in a month, that employers that have greater than 50 employees must offer health insurance to these furloughed employees. So whatever your current option is where you're paying insurance, whatever percent you're paying for the insurance, you still need to do that for them. And then Eric already covered the having a paid leave for employees who were cannot return to the office due to medical advice, and you need to cover them for a while, or if they're caring for others, including their children. So we've talked about lots of stuff today. We've got a lot of great specialists in Eide Bailey, from tax people, HR, healthcare consultants, a lot of people you can contact and get information, and we hope you reach out and do so.
So we do have quite a few questions from the chat that I thought we could go over. Some of these, some of them we've answered privately, but some of them I think it would be good to answer as a whole. One that came up quite often was what's considered a full-time employee. So for purposes of PPP, a full-time employee works an average of 30 or more hours per week. So those are the rules for PPP. What's interesting is full-time equivalent is not equivalent over each type of act that you're looking at. So of course that answer is just for PPP. Eric, did you see any questions to answer?
I saw one on there. It says, are most practices receiving their additional funds within 10 days? It's been over 10 days since we've submitted and we've not received anything. I do have practices that have received their funds in 8 days, actually. So if you've not received your funds, there is a number that you can call to see, what the status is.
And those were supposed to go out on a rolling basis, if I remember as well. Was it on Fridays?
Every week. And so it could be, it could be that you submitted on a Tuesday. So Friday's when they're issuing. So this Friday and then next Friday. We don't know what the rolling basis is, but you could have skipped. So it could be, 14 days, 13 days, or 8 days, or 3 days. We're not quite sure what that rolling basis is.
And Shonda, a point of clarification, I think the PPP forgiveness webinar is Wednesday.
Oh, thank you.
I think it's called COVID-19 Relief, Forgiveness, and Changing Legislation. There was a question on how to sign up. We'll go to the next slide. It actually talks about subscribing, but it's on our website under events. If you go to events, you can sign up, but also please go on our website and subscribe, especially to our healthcare emails. That's how the invite of this came out originally. There's a lot coming at us right now, and we're doing all that we can to try to help.
And a lot of the questions in the chat are, again, about PPP forgiveness. I am going to direct you to that webinar on Wednesday. There's going to be a lot of answers in that webinar. And then, of course, what's frustrating about the PPP forgiveness right now is there is so much gray area. One of the great questions that came up in the chat is workers' compensation. Is that considered a part of wages? Well, most of us would consider that a part of wages if we were looking in the traditional business sense. However, there is no clear guidance from SBA whether or not that's a part of wages. So if you have employees in the state of California, SDI insurance is a state tax levied against wages. So in California, workers' compensation, I think, is pretty clear it's going to qualify. Here in Colorado, insurance premiums are actually administered by a separate fund and isn't necessarily administered by a state agency. And so is that considered wages for purposes of PPP here in Colorado? I would say if you're looking black and white and wanting to be as conservative as possible, no. But if you're trying to be a little more aggressive, maybe. But really, at the end of the day, whatever you can convince your banker of is going to be the answer, because the bankers are the gatekeepers to this particular thing. But hopefully, at the end of the day, we'll get some guidance also. In these situations where you have a lot of gray area around FTEs or not being able to spend all your PPP dollars. You received too many PPP dollars. We actually have a really great tool in-house that we're consulting with clients with that offer various scenarios under the PPP. So definitely reach out to your Eide Bailly professional and they'd be happy to get you hooked up with that, work you through that tool to get some of these questions answered for you.
And also, just like with the PPP loan, there were, I think, 3 drops of FAQ questions that came out, including the night before the portals went live. That's how timely they were. So far, we have seen 0 guidance, additional guidance from the Act on forgiveness. And we expect that they'll follow their routine where shortly we'll start seeing drops of information of clarification on the forgiveness. Wednesday's webinar is from our SBA team. They're going to have the best, most up-to-date data, but I expect some of what they're going to say is we hope to hear more clarification shortly. So go with what we know, be tracking what we know can be forgiven, and we may end up having to go back and add or subtract from what we thought we knew based on the guidance that we certainly hope should be coming out here starting shortly, because they have barely finished clarifying how to get the loan. I think up till last week, they were clarifying how to get the loan itself.
We had a question in there. Is the net patient revenue based on Medicare revenue or total revenue? So it's total revenue on your last filed tax return. And it says that there was another question that says, is this times by 2% funds entitled to or standard formula, or does it vary? So, well, the first equation for the first round of HHS funds were different than this round and will probably be different from the next round. But currently, just currently today, take 2% of the total revenue on your tax return, and that's the portion that you're entitled to, supposedly. Is there any other questions?
So I think nothing that was super general. There were some more specific questions, and like Amy said, we'll answer some of those offline. We'll give the roll back to you, Amy, to wrap things up, if that's okay.
Sure thing. So as I said, the link for the webcast on Wednesday is located on the Eide Bailly website under the events page. We will send out the link to this recording and the handout most likely by the end of day Wednesday once we have everything together. So thank you for attending, and thank you to our presenters, and I hope you have a great day.